our next keynote speaker is Dr. Saleh Alkhunein, Director, Medical Malpractice Control Department, Prince Sultan Military Medical City, Saudi Arabia. He is going to talk about the artificial intelligence revolution in healthcare, transforming care, cost, and quality. Code to care. Complementing his clinical background, he holds an MBA and an MSc in Healthcare Management and is currently pursuing a Doctor of Business Administration. His professional interests are strongly focused on healthcare leadership, quality improvement, and patient safety. Please put your hands together for Dr. Saleh Alkhunein. Well, ladies and gentlemen, people say that great things take time, but artificial intelligence is growing faster than ever. And one quote I've just read a few days back said, artificial intelligence is not going to replace humans, but artificial intelligence is going to replace human without AI. Can you imagine such a contradictory statement? So let's just see what Dr. Alkhunein has to say about this. So over to you, sir.
Thank you so much. First of all, let me just tell Blazy that her performance was amazing, and she will continue to be amazing forever. I'm happy actually to talk today about the artificial intelligence revolution in healthcare, and having actually the leadership in postgraduate medical education for more than 20 years now, and emergence of artificial intelligence in the education in healthcare leadership. Let me first of all mention that healthcare leadership is something unique. I say that maybe it's the complexity in healthcare leadership is something compared to other industry having more challenges, more obstacles than any other thing. So in the beginning, let me mention that there is no conflict of interest to declare, and there is no financial relationship relevant to this presentation. All recommendation based on the current evidence guidelines up to my knowledge, and this content reflects independent analysis. Let me just mention something regarding the objectives of this presentation, something related that we'll talk about it in this presentation, something related to evolving the role of AI in healthcare. And we'll talk about some conceptual foundation and key drives. We'll talk about how the AI is transforming the care delivery. And we will talk about the impact on cost and economics, which is very important nowadays. People, they are talking about the cost, the economics, about how it can affect the healthcare. And let me just put something on that things that there is a humanitarian part in these things that different from other things. We'll talk about the quality of improvement and patient outcomes, and ethical governance and implementation challenges, and we'll talk about it. I'm a member of the National Health Ethics in the country, and we are a little bit scared of the influence of AI on the healthcare in the beginning, and me and other team, actually members in the team, in collaboration with the world leaders in healthcare, considering these things. It's a real challenge, but we will dig about that in our presentation. Healthcare system is under unprecedented strain worldwide. You can hear it in the political campaign, you can hear it actually in the media, you can hear it from everywhere that there are a lot of challenges in the healthcare leadership compared to others. Why? because nowadays we are facing a lot and heavy demographic shifts. Aging actually is getting higher and increasing in the prevalence of chronic diseases by actually the increasing the average of age. And there is more demand for the service with higher quality. The shortage of the workforce. Let me just talk about my specialty, anesthesia. Worldwide, there's always shortage of staff, if you'll find it here and there, and the expenses of that. And also the financial constraints. It's a black market. If you need a quality healthcare, you have to pay more. In this context, the health system faces fundamental challenges. Is the big question: how to deliver a higher quality care to more patients at the sustainable cost? It's a very complex equation. Can we actually offer the same quality of care for growing population with the same quality all the time? Not always like that. It has emerged actually that the key enabler of the transformation is AI, or claim to be that AI is one of the enablers of transformation in healthcare. Unlike the earlier or the previous digital technology, that mainly it was facilitation of the storage, facilitation of the communication, and we say that AI enable advanced data analysis more than the digital health technology, the older technology. It actually gave more actually recognition compared to other things as predictive values, and also as predictive capabilities compared actually to the traditional healthcare leadership and those with digitalization. So these features of AI tool is not for the efficiency and never been only for the efficiency, but also for, as a fundamental things, for reconfiguring how care is delivered. And the integration of the AI tool is not purely actually technical things, and never been only a technical things. And this actually represents the complex of the socio-economic technical transformation. That's why you'll find that trials with AI in some actually system, complex health system, fails. Although they invested millions and sometimes billions in transforming these things, but still actually fail for many reasons. So it involves actually the changes in the clinical practice, organizational structure, that should be considered, and also the regulatory frameworks, the patient engagement. So it is more than one actually pillars if we will be consider all of that. So evaluating AI, in reality, it requires multidimensional approach that not only considering the technology, but also considering the infrastructure, the capability of the institution, the quality, the cost structure, and also the ethical principle which should be considered. If we'll talk about, let us go deep in critics of the healthcare transformation and the role of AI in that. From critical perspective, to just look to the AI in transforming the healthcare system, being part of the patient safety and being actually as part of a healthcare network of around 26 hospitals I'm working with, the quality and medical legalities and patient safety is actually a pillar. So recruiting the AI in this complex system, healthcare system, usually we are taking these from three actually parts or three sides. The care, number one, cost, number two, and quality. Are we going to keep or to maintain acceptance and maintenance of these actually three pillars while addressing the broader challenges to the implementation and governance of AI in healthcare? So the argument always came from the transformative potential, which depends on the alignment with healthcare values and integration into a real value clinical care. Does that actually will improve the patient access of care? Does that actually improve the quality of care and the coverage of the service or not? If not, there is no need for that. It's just cost for nothing. Otherwise, if it has influence on that, and we'll come to a couple of studies, for example, to just dig about all of these things. So let us talk about one of the constraints of AI in healthcare. It's not industrial things, it's not banking, it's not finance, because it's touching human being. It's touching health. So we are always considering the socio-technical innovation and those things. Because we are offering care for a professor in the university, for a scientist in NASA, we are offering care for a farmer, we are offering care for somebody who's a simple laborer, and for me as a doctor, they are all the same. We are treating all the same for all of them. Quality of care, access of care should be actually equal to all of them. So if I am implementing an application, for example, for those things, I have to consider that this application will be in the hand of everybody and should be easy. So it's not actually a technology, it is socio-technical system that emphasizes on the interaction between technology, people, process, organizational structure. Defining the artificial intelligence in healthcare especially, and I claim that healthcare, they are recruiting the AI compared to other industry actually area. So it is a range of technology. Now it is including actually in healthcare, we are recruiting machine learning, deep learning, the natural language processing, robotics. And Saudi Arabia, they started in more than 10 hospitals, robotic surgeries, where the surgeon can stand away and he can do procedure from away, and sometimes he's not even in the place. Okay? So it enables, if we will take it from clinical data or administrative data, so it analyzes the database, identify patterns, generate predictors or recommendations. We are using that in clinical decision, supporting system, diagnostic tools, mainly in pathology and radiology, predictive analysis, so to see where is the risk or what shall I do for the next step. And also for the administrative automation and patient engagement platform. Nowadays, many hospitals, they have application to be in your hand to look for your investigation and workup, and also to communicate with your doctors and so on. And if we are talking about the administration and automation, I was leading a department where maybe up to, in my calculation, 28% of the staff there, they were not performing well. Many leaders before, they tried their best to engage them in the process, having sick leaves, not performing actually, manipulating, and doing things. I found that the only solution is to build up a platform which can analyze a real-time dashboard which can realize the performance of the staff. They are lawyers, and they are administration, and some of them, they are clinicians in the medico-legal part. And the good thing about it, that it gave us transparency, predictive values, where's the gap? Sometimes it is hidden. And at the end, it became like a bad Apple platform, which can, if somebody actually is not productive, is not engaged, and we try to help them to be engaged with the process, otherwise, thank you, and in the first station to go out of the train. Okay? I'm not that a bad leader, but I'm trying to help others to be engaged with the system. Sometimes, actually, whatever you do, still, actually, some staff, they are not actually performing well. So the issue of AI depends on the alignment of the clinical workflows. No one can build up an AI without inclusion of the workflows in the health care institutions. And the integration of the existing information system, the health information system. Many failures in AI, it came that from the point that there is no involvement of the health information system. That's why the algorithm actually became biased, not clear, and that's why it failed. So not only that, but it has to be accepted by majority or almost 100% of the staff. They should accept it. They should trust it. And that's why whenever we are building an AI, we have to do an extensive awareness for all medical staff that that's what we are going to have. So they should be aware. It should be made easy, not actually complicating the issue. And we should reach a trust for the engagement of the patient. Sometimes we are doing awareness whenever they are following up in the outpatient. We are sending for them text message, for video clips to describe for them how to use it and when to use it, how to communicate it. And we have to consider that they have individual variation in education and everything. And as I told you, all of our patients, we are treating them the same, whether he's VIP or non-VIP, educated or non-educated, we have to actually reach all of them at the same quality. A major limitation of the AI discourse is the determinism or technological determinism, that we assume that this innovation is 100% will lead to improvement, which is not true and not always true. And the evidence in many studies, it suggests that poorly implemented AI can disrupt the workflows. And many institutions, they have more poor performance compared actually to the conventional things. And increase the cognitive burden, exacerbate inequalities. I have a friend of mine, he's actually a pediatric intensive care consultant. He did a study last year. I tried actually to bring it here. And he found that during the training of 4 years training in pediatric intensive care, he found that 0.8%, 8 months out of 4 years are spent on the health information system to extract data and to process data and to write and to type the history, examination, and processing. So almost touching 25% of their training spent on that. And this is actually not good. We brought the technology to help us, not actually to increase the burden on that things. So this, from critical approach, it is essential that the AI can do, but what is actually achieved, not only what is AI can do, but actually what I can achieve with this AI, okay? The AI, in its core, it's a potential things to enhance the diagnostic accuracy, supporting clinical decision making. Nowadays, people, they are talking about radiology, that AI can replace human being in radiology, which is not true, and it will never happen, okay? That I'll be totally dependent on AI to interpret and write a report of radiology study, brain MRI, or CT scan, or whatever. It never actually replaces the human being, it will support them. And we actually recruit the machine learning algorithms, for example, in national census, for national registry, instead of having manual, to reduce actually time for all of that, and in patient records and so on. So I can extract the data for me as a leader to bring all data for me actually, and to take a decision in a predictive way, not a proactive way. So the predictive models, whenever it is recruited, for me as a leader, I will decrease actually the risk of deterioration, the enabling early intervention, as I told you before. These advancements are promising, but actually there is a big question about the autonomy and accountability for me as a leader. If the machine learning will take a decision, so who will be the responsible about this decision? Me? Yes. Me as a leader, human being actually who put these things. And for me, as a leader, executive leader, and also leading the medical malpractice, and also leading the education and processing, we have now in Saudi Arabia more than 900 postgraduate in anesthesia and an equal number in intensive care, following them up, following their performance. We are aligned with the American Society of Anesthesia with a platform that do frequent quizzes. I know where our students going. I know their performance, I know their knowledge, I know their gaps, so I'm following them up in different institutions, different universities, so we know where we are. If the clinician rely mainly on the AI, the automation bias will be there, okay? So where human judgment is subordinated to algorithmic outputs. So it depends on the data I fed it to this actually algorithm, whether it will guide me in a right way or will guide me in a wrong way. So there will be actually chance for bias. So the lack of transparency in some AI systems that I told you that it depends on the reality that the data and algorithms that fit these things, sometimes actually it deceives the decision making and it corrupts the system itself. So this, transparency, it complicates the clinical decision and also accountability. If I'm in a health institution X and I'm feeding these actually with bad data, it will read the wrong habits more than once, and then it will give me always the wrong decision. So AI, yes, it enables shifts from reactive to proactive, as we have said. It actually gave us predictive analysis that identify high-risk patients, allowing targeted intervention, and also the precision of medicine supported by AI integrates genomic and clinical data in tailored treatment. The next era of medicine practice that it will depend on the data from all families. For example, if I'm talking about diabetes, hypertension, other chronic diseases that run in family, it has genetics, it has actually racial, genetics, and environmental factors. So it can predict, for example, Saleh will be diabetic after 20 days, after 20 years or 30 years. So it can predict based on the genetics actually data, on the history data, and on the national data, which can fit all of them. And not only that, but also it will, from administrative point of view, we build up a system that can predict the performance, and we call it BAP. BAP, in my language, it's a door. So whenever there is a staff, he is performing in a way or another, he can be actually going to the green, it is color-coded, green, yellow, orange, red, and black. At the end of their performance, actually, it can predict how actually I'm recruiting bad or good people performing actually in a bad or good way, okay? And that's why actually it gave me a prediction as a leader for whom to keep and whom actually to expose them to more training and to solve the problem with them. Okay, so again, from a critical point of view, although actually these things are so good, but it is not without risk. And my colleagues in the first couple of sessions, they were talking about the data privacy and cybersecurity and the equity of these things. So access of advanced AI can be uneven because I cannot reach those people. I cannot actually invest in data for this institution because it is very expensive. It is in a rural area, while in this area, actually, I supported them with all AI facilities. So it can be uneven. So are we ready from financial point of view to go through that or not? Are we ready actually for data privacy, cyber attacks, and so on, or not? And it's not talking about how many thousands of dollars in my account and bank. It's talking about my privacy, my disease, my procedures, where I get it, which is very confidential and very private. So the predictive models may reinforce the existing bias from trained or non-representative data sets. And that's why one of the things that we are training people, maybe the engineer here, he's smiling, and I know actually what he wants to teach us from that. If there is bad data sets, it will drive me in the wrong way, okay? So AI, yes, it has the drive to reduce potential burdens, to improve workforce efficiency. It happens mainly in administration and automation of routine tasks that allow us to focus on patient care. Let me just give you an example. In anesthesia, whenever I'm a neuroanesthesiologist, so I'm doing anesthesia for neurosurgeons. So I'm always busy with infusion pumps here and there. I'm always busy with doing procedure here and there. I'm always busy with treating complications that happens, for example, arrhythmias and so on. So, and also at the same time, I have to write on the document what happened, what medications I gave, blah, blah, blah. Nowadays, we have modules that whenever I put anything, just enter it, it will take fraction of seconds. So I'll be hands-free. to concentrate on the patient and to prevent the complication as soon as possible, mainly talking to the brain because time is brain, and so on. Yes, it facilitates my life, it makes my life easy, but unfortunately it is very expensive, it's not available everywhere. The introduction of AI, in reality, whenever it is there, it claims that it will redefine things. It will actually, there will be skill gaps. Saleh, for example, is different from George, is different from Alice, different from somebody else. There is a skill gaps between us. Someone, he can utilize it actually properly. Some actually there will be resistance among healthcare. They said that it is waste of time. It takes a lot of time. So without adequate training engagement, it may be perceived as a threat rather than a support tool in many institutions. So AI can improve operational efficiency, scheduling, resources, allocation, outflows, and management, mainly in daycare surgery. And we actually working on daycare surgery because nowadays it reaches touching 65% of procedures done in the hospital. Not like before that we are admitting everybody. Nowadays, because of cost, as I told you, we are doing procedure. At the same day, we're keeping the patient for a couple of hours and then sending them back, having actually nursing visit, home visit. It will reduce the cost, but at the same time, there is an application in the patient hand. If there is any problem, he will send an alert. At that time, we can react. Sometimes they take a picture, and we can decide in telemedicine what to do and how to do it. Not only that, but as I told you that it is in predictive analytics, it can forecast the demand, reducing bottlenecks, improving system responsiveness, and sometimes the good thing about the healthcare leadership, or let me just, the complex thing that it is not only clinical practice. We are talking about the supply chain, we are talking about administration, we are talking about the pharmaceuticals, we are talking about a lot of things. If there is any supply chain, that will be enough, for example, for the next 1 or 2 months, there will be alerts from there that we have to plan our schedule based on that. So efficiency are often cited as key benefits, but the empirical evidence remain mixed. Studies of failure of the system came from the idea that there was no proper recruitment of AI in the system. So some studies, they were talking about cost saving, while others indicate that there is actually increased cost. All of them, they are right, by the way. But all of them, they were talking about their size and perspectives, how they implemented actually this tool. So reducing waste and overutilization, at most of the time, from financial point of view, yes, AI, it reduces overutilization. There is also a risk of resilience on the technology that leading actually unnecessary intervention from the algorithm and recommendations. Sometimes in some hospitals, they kept repeating the same workup, doing that once and twice and thrice, connecting these hospitals, connecting these facilities, acceptance of workup investigation from other hospitals. It will connect the healthcare facilities. For example, in my health work, 26 hospitals and more than 200 primary healthcare sections. We are doing the same workup for all of them. All health care profile are shared at the same time, so there is no need for the patient to jump from one place to another, so we can track them all over. So one of the things when we are talking about AI is the value-based healthcare. Actually, the AI supports the transition from volume-based to value-based care by aligning the cost with outcome. So it actually integrates everybody: supply chain, finance, purchasing, patient affairs, leadership, clinical decisions, multidisciplinary actually clinical departments at the same time. So the integration of the value-based model requires a robust outcome measurement and data infrastructure. Without it, there will be actually not that good quality. So which may be available in all settings if it is recruited in a proper way. Talking about the quality improvement and patient outcomes, the reliability of the system and errors in algorithm, as I told you before, which is one of the big and major challenges, is reliability of the algorithm which was incorporated there, and highlighting the need for rigorous validation and monitoring. It's a lot actually to talk about, so I'll try to be faster. AI can reduce variability in clinical practice by providing a standardized recommendation, and standardization may improve consistency, always accreditation of algorithms, and the standardization of the algorithm in the place can also limit the clinical flexibility sometimes, some clinicians, and mainly actually in those things. The ethics and governance will be talking about data privacy and security, bias and equity, transparency and explanatory and regulatory framework. I will just go fast because they told me that I have only 2 minutes. And the ethical challenges are not peripheral, but central things. And without robust governance, AI may undermine the trust and exacerbate the inequalities. I'll talk about the Saudi Arabia, the challenges that bridging the theory, the organizational readiness, workforce training, integration with existing system, and continuous evaluation. That actually, from our point of view, AI as initiative failed not because of the technical limitations, but because of the poor implementation strategy, as I told you. And also this highlights the change management and stakeholder engagement, which is one of the major things that one of the causes for failure. From code to care, critical framework, that the concept of code to care emphasizes that need to align the innovation with the healthcare values. And without alignment of these values, actually everything will go wrong. As I told you, that healthcare is different from any other industry: patient-centered design, clinical value and outcomes, ethical and responsibility innovation, which may complicate the issues more and more. So a framework of challenges that technological innovation is inherently leads to better care, not necessarily always, because unless we are involving everybody together, it will not be actually the reality. So it is value-driven implementation. The AI rapidly transforming the healthcare system in clinical decision-making, yes, improving the operational efficiency, enabling personalized and predictive care, but also it depends on the infrastructure and also depends on what we have. So the impact of the AI depends on the dimensions like care delivery, cost, and quality of the outcomes. I will pass this slide just because I know that the time actually is limited. In Saudi Arabia, yes, we implemented the AI for the last couple of years. So from the operational efficiency, from diagnostic accuracy, and patient experience access to care, especially in my institutions, I will talk about application in the whole country. We called it Sahhati, which is an application for everybody. He has his own actually file is there. And we have actually Sahha virtual hospital, which is the biggest in the world. We have a virtual hospital there, and National Health Information Center talking about that. So we have the Saudi Data AI Authority, SADAYA, and we have Ministry of Health Digital Transformation Program as initiative for the country, and we are part of that. So enhancing the early disease detection, cost efficiency, data-driven, actually, and telemedicine is growing up mainly in tertiary care. We're not far away from actually finishing. So the challenges, like everyone, we need actually for skilled workforce, a risk of automation, ethical things. It's like the international challenges happen here and there. So the Saudi experience, we has a potential to transform the Saudi Arabia healthcare AI implemented, and the complete success is really will never happen, neither in Saudi Arabia or everywhere, unless we have balancing innovation with governance and ethics and patient-centered care. It's not advertisement, but actually I will just give it for free for any educational and academic institution. This is actually my book, one of my books actually for 2026. So if anybody actually contact me, I can give them an electronic or digital copy. So take-home message, AI is transforming healthcare in a profound way, in a new possibility to improve the care delivery, reducing cost, yes, enhancing quality, but the success depends on the technological, more than technological innovation. The Code to Care provides a framework from ensuring that AI contributes to meaningful improvements in patient outcomes, otherwise no. And the future of healthcare depends not only on the sophistication of algorithm, but how effectively we recruit all of these things in compassionate and in equitable care system. Thank you.